Welcome again to our Virginia Partners in Prayer and Prevention Disparities Grant information session. The funding that we will be speaking of and funding that we are supporting is coming through our Centers for Disease Control and Prevention, CDC, national initiative to address COVID-19 health disparities amongst populations at high risk and underserved, including racial and ethnic minority populations in rural communities. Next slide, please. Today's facilitators will be myself. I am Veronica Cosby with the Virginia Department of Health, Office of Health Equity. I'm the program manager for our Virginia Partners in Prayer and Prevention Initiative. I oversee our FBO and our HBCUs funding through our CDC grant that supports this information session. In addition, my colleagues, my counterparts, Kanique Ferguson, our procurement manager within the Office of Procurement General Services, that's new for me to share, with VDH, and then also Kimberly Bowman, our division director with General Procurement and Resource Coordination for VDH. So you'll be hearing from us, all three of us, on this afternoon, and we'll be here to answer your questions as well. Next slide for me. So as we get started, we want to dive into this information session. Many of you are familiar that we have been working with this funding for the last year. We started our first cohort December of 2021 and just ended our first cohort actually November of 2022, which just ended. So with this funding, we are now in our fifth cohort. As you can see, this is RFA number 2023-01-OHE. This grant opportunity, like those before, this one was issued December the 15th, which was just a few days ago, less than a week ago. And the application deadline is going to be Tuesday, January the 24th, 2023 at 3 p.m. I am going to let you know I'm going to be very repetitive in regards to these dates, especially with the deadline date, and for inquiries as well. This application's deadline is January the 24th, 2023 on a Tuesday at 3 p.m. Eastern Standard Time. And so you're going to hear that a number of times on today. So let's continue. Next slide, please. The period of performance for this grant will be from February the 15th, 2023 to February the 14th, 2024. There are no renewable options for this grant. The grant award floor is $1,000. The ceiling is $40,000. Again, the application deadline will be January the 24th, 2023 at 3 p.m. Eastern Standard Time. There are multiple awards that will come from this grant. And I say that within our first calendar year, we were able to award 70 grantees. We just ended one cohort, and we're still adding two. So there are multiple awards that will be awarded during this grant. But again, there are no renewables. For those, I see some of our first cohort grantees on the call. For those that were in our first cohort, which ended November the 30th of 2022, you are eligible to reapply. There is no extension, there is no renewal. You would be reapplying for this grant for the next grant period, okay? Such as new applicants. Next slide for me, please. Okay. All inquiries for information you would either contact myself, but I'm the program manager, or Kanique Ferguson, our procurement manager, for questions up until Friday, January the 6th, 2022. Well, it'll be 2023. Close of business. And so close of business, I will say I have gotten calls at 8 o'clock at night on the closing day, but close of business, please. And if you're applying for this grant through by mail, you will be sending it to the address that it's shown here. And these are things that we're going to be going into detail on the RFA and instructions and guidance for this grant. So these are just some preliminary notes that we're giving you now. Okay, next slide for me. Okay. And as a preliminary in regards to this grant, just making sure you are aware you can apply for this funding by mail, meaning that you can have your application delivered to us by mail, in person, hand delivered to me, or my staff, my team members, or via RedCap. And the address again is below for those that will be mailing your applications. And being specific to that, I will be giving examples throughout this throughout this information session, because I have gotten grant applications that were emailed in. That is not acceptable. Grants can only be received by mail, in person, or via RedCap. Okay. And throughout this information webinar, we will be again sharing the additional guidance in regards to how you can get the detailed information on this, and then also a follow-up email will be provided to you. And on this, with this PowerPoint presentation, this will always also be provided to you as well after this session. And then, of course, no email and no faxing as well. Next slide, please. Okay. Now, just to share, and I've gotten this question since December the 15th in regards to, does this funding support things that we have done before that addressed COVID-19? No. This funding does not address efforts prior to our grantee period and award, and then the grantee period if your grant was approved. So specific programming does not provide relief that offset costs for prior expenses incurred by faith-based institutions and organizations. And I will encourage you, if that is your case, FEMA public assistance for houses of worship, that reimbursement, that funding, it still exists. However, the deadline for that, they're closing it out by the end of this month, which gives you a little bit over a week. So again, these are for efforts that you have had during COVID, such as your PPE, your outreach events, and so on. So please refer to that public assistance through FEMA. It will be ending. It will be ending by the end of the month. Next slide for me. Okay. So to talk about this award, the purpose for the request for applications for this award is to establish contracts through competitive applications with faith-based organizations and institutions within the Commonwealth of Virginia to develop and implement strategies for enhancing COVID-19 vaccination efforts through outreach, education, opportunities to expand vaccination accessibility. So we're going to talk a little bit how that looks, because at the first glance of it, it's like, oh, well, we're from pandemic to endemic. And so the strides of maybe having more vaccination clinics does not look the way it looked last year or the year before that. So what efforts, what activities can this grant support? So we're going to talk about that today. And so again, with this is the RFA. RFA can be found on our eva.virginia.gov. We'll also make sure we send it out with the response and correspondence from this email as well, from this call as well. And again, just to discuss in regards to this funding opportunity and when a final decision will be made, which will be February the 15th, 2023. And again, the grant period is from February the 15th, 2023 to February the 14th of 2024. So these funding does not support efforts before that February the 15th, 2023. Okay. Next slide. So as I'm going through this is actually information that's on our RFA, which we are going through at this time. And so just to give you a little background, we know that with COVID-19, it came quickly and it's still here. With that is that how are we, even as faith communities, getting back to the reality, getting back to things as normal, even from the impact of COVID. So COVID has affected many of our areas, our communities, our places of worship, our businesses, our schools, and so on. So how do we take this work and the work that you're already doing and move to creating an atmosphere, creating a space where we're being proactive in regards to our health and not waiting till the next pandemic comes along that we are then reactive. And so want to make sure you are connected with Virginia Partners in Prayer and Prevention. Our efforts have been in existence since 2016. I've been here this long. And with that, we are here to be that medium, be that support, engage with our faith communities, and make sure that we are all connected from our churches, from our local health districts to our state office, and then also other state agencies, because we do not isolate. We all work together, and we cannot build health and enhance health and build everyone's capacity to be healthy without doing it together. So please stay engaged. If you're not a part of our newsletter, we'll make sure you get connected and include you on there. So Virginia Partners in Prayer and Prevention, and I will say we're just glad through VDH, the Virginia Department of Health, Office of Health Equity, that this program was established to support and stay and keep our faith communities engaged. Next slide, please. Okay, so just to dive a little bit deeper, because again, I want you to know the connection with this funding. And like I said, initial efforts when we started December of 2021 were clearly that there was a definite need in regards to the education, in regards to COVID-19 vaccinations, also reducing myths and misunderstanding. And so where do we go from there? Okay, where do we go from there? And this is where we want to start, and this is where we are. You know, how are we reducing health disparities as an impact of COVID-19? And that is actually the goal of this grant. But it looks different based on where you're located. What is your current need? What is the current work that you're doing in your faith community, in your community, to drive health, wellness, not only mentally, physically, emotionally, and spiritually? So let's talk about health disparities. And then also in the RFA, I give you a glossary that will support and provide additional information on these definitions and some of the terms that I am using. And yes, the recording for this will be made available for you. And so when we talk about health disparities, we talk about preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by social disadvantaged populations. And we can say in our faith communities, in our communities, that this exists. Okay. And so the many factors that contribute to health disparities include, of course, yes, genetics, access to care, poor quality of care, community features such as food access, poverty, violence, um, environmental conditions, um, language barriers. So when we're thinking about what you're already doing, what you're doing, we're looking at these health disparities in regards to how can we reduce some of this as an impact, because of course COVID was not the only pandemic we've gone through, but it has created an additional barrier to the disparities that already existed. So how do we work together? How are you all working in your communities to doing this, and how this funding can support your efforts? Next slide for me, please. And I want to be mindful of the time. But as we talk about health disparities, we have to get in a place where we are reassessing our understanding of health as an impact of COVID-19. Okay, knowing what social determinants of health is, meaning those areas that are non-medical factors that influence our health outcomes. And much of the work that you're doing is doing exactly this in those areas that you are focusing on. And so I will again share this PowerPoint with you. So there are some additional resources that you can dive into in regards to this grant and those focus areas and activities that will apply to it. Next slide for me, please. Yeah, and this is just a extended expansion of that photo before, that expresses and shares additional information in regards to the social determinants of health. And with this, our goal is to create opportunities and motivating our community. How can we, and think about this as you're considering your program and your project that you're working on, that exists or looking to work on, reducing health gaps, strengthening resilience, innovation building, and building community capacity. Again, how are we reassessing our understanding of health? Okay. Next slide for me, please. So in giving that, I'm sharing some additional resources with you, additional guidance in regards to health equity, social determinants of health, health disparities, data resources. So if you're talking about a program in your community and we ask you, why is there a need? Your data is there, not only from our VDH database, also our CDC database. And also we have a health equity dashboard as well through VDH. So we're providing you the tools to support you in your application. Okay. Next slide for me, please. Now, eligibility in regards to this grant. And please let me state that with this grant, this RFA can be found on eva.virginia.gov. And I have my team members on this call. If you can just put in the chat box for me that email link, we will have that provided for you, and also after this webinar as well. So Well, as we talk about eligibility, specifically this initially we were, this grant was awarding to faith-based organizations and institutions. With this fifth cohort, we've extended that a bit. We are aware that there are many faith-based organizations that have become their own 501c3 and has separated from their initial establishment, which are able to apply for the grant. Also, we also understand that there are many faith-based organizations that are always partnering with community-based organizations and may not have the capacity to facilitate the grant. So there is an opportunity for community-based organizations to actually apply. However, this is working with a faith-based organization, an entity, and we will be requiring documentation from that FBO that you are working with. Okay. Addition to this, verification for not only 501c3s, but for faith-based organizations that do not have a 501c3, a letter of determination will be acceptable for this grant. So all grantees or applicants will have to show proof of either a letter of determination, that is not your EIN letter, or your 501c3. And I do ask, and I'm going to give you an examples as I shared before, is that if you're waiting on either one of those documents, that means that is not an acceptable document, meaning that I'm going to put on a Word document and say, I am in the process of obtaining this information. If it's not valid at the time of your submission for your application, it is not acceptable. Okay. And then also EVA and SAM's registration is required for this as well. And you're going to see here's some things that are going to be very repetitive during our session. So we will make sure we get all of these specific details to you. But again, we're going to be a little repetitive with this, so bear with us. We want to make everyone to have all the tools that they need for applying for this grant. Okay. All right. Next slide for me. Okay. And I just saw a note in regards to a question in regards to DUNS, and I'm going to get right to that shortly. So EVA registration is required. And so with that, we will give you the supplier registration form. Okay, this is EVA has recently been updated, so it's a little bit more user friendly, and you will know that if you're existing, you don't have to actually reapply for it, but it's very user friendly, and we will get the guidance. And also the guidance is found on EVA under the RFA of how to register for your EVA registration. And this is required. So I will say this, and again, I'm giving examples here. Please do not wait until the last minute, meaning that January the 24th, and you're online putting your application. Please don't wait till the last minute. The last days of the application, and you want to then register for EVA. That process does not take a split second. And so if that EVA registration is not accessible or available complete, then it is not going to be acceptable. Okay, so I encourage you to register for EVA, because they are not only this opportunity, but other opportunities are available on EVA for you. So please connect and engage, get to know EVA. I call it the J.C. Penney's catalog of Virginia. Okay, next slide. I saw a question in the chat. So SAM's registration is required. I have two experts on the line, which is Kanique and Kim. And so I will make the note and definitely share that with this SAM's, which is their system for award management, is going to be a requirement. And this has been a change as of April 4th, 2022, that the unique identifier used across federal government has changed from DUNS number to this unique identity ID. Okay, so there has been a change. If you had a DUNS number, we will be requesting that you register your for your SAMs, your unique identity number. And with that, there's no charge for any of these registrations, whether EVA or SAMs. This is free. Okay, and so again, we are going to encourage you that you do review these sites. Again, we'll show you and give you those registration links for you as you proceed. Next slide for me, please. So as we talk about your registration, we're going to talk about some unallowable costs, because we've talked about where your scope of programming can focus on, what it can relate to, but we want to be mindful, make sure you're aware that there are things that do exist that are not allowable for this grant. Okay, and first is that this grant's max has increased from 20 to 40. So your application should not come in asking for $45,000 or $50,000 or $60,000. Sorry, the chat is going live. There are additional questions, and I will, if Kanique or Kim can answer any of those in the meanwhile. But with this, do not exceed the 40,000 ceiling that we have for this. Also, a lack of your projects direct link to COVID-19's impact, outreach, engagements, and reducing health disparities. So if you send us a grant or have a grant that said, this is what our programming is, the grant is reducing health disparities as an impact of COVID. So it has to show a linkage here in regards to that. So being mindful of going through your project narrative and being specific to how these things are connecting and what are you seeing in your communities as this has impacted and created barriers for us all. Also, this funding does not support religious sponsored events or are not limited just to your church. Okay, this is for your community, your surrounding populations, community members, then also funding inherently for religious activities. So this does not support your Bible study meetings or your regular church services or conferences or convocations and all those things. And you can be able to click on the link to get the additional information in regards to that. Funding does not support travel expenses, completed projects, debt reduction campaigns, building endowments, land acquisition projects, construction projects, general operation cost, fundraising, raffles, alcohol, entertainment cost, advisory boards, honorariums, invitations, any patent or licensing cost, lobbying, meals, pre-award cost, promotional items, okay? And when we say about promotional items, some things such as if it's like the COVID related, your hand sanitizer and things of that nature. Some people like to get the larger piece or small containers. That's considered to be something COVID related. So that's something to discuss. Again, January the 6th will be the last day you will be able to have any inquiries on any specific things. So I do encourage you to contact me. Clinical services. So I have gotten many calls in regards to mental health services. The funds are not allowable for clinical services, including any billable services. So that means your day treatment counseling, your one-to-one counseling, anything that is billable. So you are a mental health clinician and you charge this and you want to have someone come for free. This is not, it's not allowable for that. Now, If you are having wellness sessions and you may have a speaker that comes in regards to talk about such as your well-being during a certain time of the year or grief, that you're speaking to a group, okay, of individuals, but individual or clinical services are not allowable for this grantee. Underwrites sponsorships and FEOs may not receive funding for more than one project at a time. If you are currently a grantee in an active grant cohort with this grant, you are not at this time able to apply. We only have one grant cohort that has ended, and that ended on November the 30th. So you will not be able to duplicate funds or apply for funding in this cohort if you are already active or existing. Okay. Next slide for me. Okay. And so this just dives into the program requirements as specified for CDC and their specific goals for CDC health disparities funding that Virginia was awarded back in 2021. And so reducing COVID-19 health disparities, improving and increasing testing and contact tracing among populations of high risk, also improving state, local, and US territorial and freely associated state health departments capacity and serving to prevent the control COVID-19 infection. And so this means we can't do this work alone. This work extends to our communities. It's extending to what you are doing in your communities. As our faith communities, again, I always say that we were public health before there was a public health department. We were hospitals before there were hospitals. We were care centers, I say, before there were care centers. We supported our seniors before there were many senior homes. And so many of our faith communities and the homeless, many churches are homeless shelters. So we are doing the work of reducing health disparities, and the work that you're doing, this funding can support those efforts. And so I do encourage you to read this RFA thoroughly because your guidance, your instructions is within this, is going to be within this packet. Okay. And next slide for me, please. Okay. And so as we talked about the project. This is a project AIM, and this is what we're doing. We're mobilizing partners and collaborators to advance in health equity and address social determinants of health as it relates to COVID-19 and health disparities amongst populations at risk and underserved. And so as we talk about and go a little bit further in regards to the scope of the work and services, strategies, and activities that this grant will support, all of them should aim to build an infrastructure of both addressing reducing health disparities in this current COVID-19, we're in endemic mode, but doing from pandemic to endemic, to set a foundation to address future responses. So again, as we thinking more proactively instead of reactively, so not waiting until the next pandemic comes, that we then we go into fast mode. So how can we look at health? How can we help our communities, whether it is through working with our seniors, working with our youth, working to expand their capacity, not only in just their activities, but their behavior in regards to, it could be nutrition classes and things of that nature, because we know in many of our communities, we have levels and we have persons that are dealing with high blood pressure, hypertension. We're going in February, we'll be in Heart Health Month. But then also there are other areas that are chronic disease and self-management. There's Alzheimer's, there's arthritis, there are so many areas, but then how are we equipping our communities to be healthy? And our faith communities are trusted leaders in the community. And again, you have been doing the work. Many of you have health ministries, doing blood pressure screenings, having health events to help get the information to the community and be the medium that they'll be able to receive resources and connecting them as well. So next slide for me, please. So that will include, and these are just some activities of focus. I want to make sure I have time and give time to my other counterparts, being mindful of the time, and examples of activities as well. Okay, so this will be shared with you. And these are many activities that you're already doing and have been doing. Next slide for me, please. Through this grant, you will be also required to have quarterly reporting. So we want to know what you're doing. So as we are funding, there are some things that are going to be required from you. They're going to be required from you in regards to evaluations, your actually in regards to your reimbursements, your invoicing, also your time. So it's going to be very important when you're considering this funding and those that will be responsible for managing this funding, that they are knowledgeable to not only the tasks that they have been appointed to, but then also the responsibilities that come with the grant. So there will be quarterly reporting that will be asked for, and we and my team, we give sufficient time for those things to be given and completed and given back to us. Next slide for me, please. And so that does not come without saying that VDH is here to work with you. And through this grant, I have been able to build a team of individuals to support you during this grant year and during your grant year if awarded. And with that is that you will receive an orientation for grantees that are awarded. And then we will be talking about and making sure you have the understanding that you'll be straight and be guided through the entire year. Also, we will provide feedback, especially when we're talking about those quarterly reportings, because as we are receiving funding through CD, we have to report back, and those have timestamps. And so we want to make sure we are reporting back from this funding, because again, this is very unique funding, because this funding is going directly to our communities, not a third party, but directly to our faith-based communities. And then this is very important. Okay, we will provide technical assistance for grantees. We will be making site visits amongst your award. That does not mean that you have the choice to choose. But we will be making site visits, because we are not in doing this alone, because we want to see the work that you're doing. And sometimes that can be announced or unannounced. And then you will be required to have a one-to-one meeting at a minimum with your grant, your project coordinator once a month. Some may need more time than that. We have staff that is accommodating for that. Because we know that we are meeting you and meeting our communities where they are in regards to efforts such as this, and even understanding the grant process. So we are here with you and to work with you during this time. So next slide for me, and I'm going to pass this over to Kanique Ferguson, our procurement manager. Please, Kanique.
Hi, good afternoon, everyone. I hope everyone can hear me. Thank you so much for being with us this afternoon and being here. We're really excited about this cohort. I'm just going to quickly go over the next couple of sections. We're at section 5, application submission information. As Veronica stated before, there will be a lot of dates that we will repeat over and over again, but it's just because we want to make sure that there is no question about dates. In order to be considered for selection, an applicant must submit completed applications no later than Tuesday, January 24th. And on this PowerPoint, there's a little slight typo. It should be January 24th, 2023 at 3 p.m. Eastern Standard Time. Responses received after the submission due date and time will not be accepted. And VDH is not responsible, for any delayed delivery or receipt of applications. So this means that even if it is postmarked, if it comes in after the date and due time and response date and due time, it will not be accepted. It has to be in hand prior to prior to that due date and response time, Tuesday, January 24th, 2023 at 3:00 p.m. Eastern Standard Time. Application submission instructions. There are basically two ways that you can respond to this. You can be able to submit your response electronically through REDCap or by hard copy, which means hand delivered. You can be able to follow the REDCap application link, which is right there as well in the PowerPoint presentation. And you can go to the next slide for me. And then hard copies, which are printed out application submissions. The application and all required forms and attachments shall be provided in the following number of copies. So if you choose to do the hard copy option, you want to have 6 hard copies printed, 1 marked original, for a total of 6 copies with the RFA number and the name of the applicant organization. And hard copies of the applications shall be mailed to the following address. You want to make sure that they are mailed to Virginia Department of Health, Office of Health Equity, Veronica Cosby's attention, 109 Governor Street, 7th floor, Richmond, Virginia, 23219. If you decide to hand deliver it, you have to make sure that and we're going to just tell you, we would not suggest you waiting until the last minute to try to hand deliver it. Because as you may know, where we're located in downtown Richmond, sometimes it's very hard to find parking, and our building is not necessarily in a area where you can just be able to easily get through. So definitely make sure you plan it out and kind of make sure that you're aware of that beforehand, okay? You can go to the next slide, please. Also, we want to make sure we reinforce that applicants must be registered with EVA and also sam.gov in order to submit your application. And to register, you would go to eva.virginia spelled out.gov. We've also included a registration packet on instructions on how to complete the EVA registration as well. And then also the sam.gov information is included as well. And you want to make sure that you have requested your unique entity ID number, which is replacing the DUNS number. Next slide, please. All right, and application preparation instructions. As we spoke about before, you just want to make sure that you submit all information that is requested, because if you aren't able to do that, it may result in VDH requiring prompt submission of missing information and or giving a lowered evaluation of the application. If any prospective applicant has questions about the specifications or other application documents, the prospective applicant should contact the program officer. And this date actually looks to be incorrect. The date that you need to, Veronica, can you please verify that date for me? Because this date actually does not look to be correct. Give me 1 second, guys. I will verify.
And the date for the last inquiries is is actually January the 6th, which is Friday, January the 6th, 2023.
So that date is going to be January the 6th, 2023 And you want to make sure that all of those inquiries are into us by close of business, which is 5:00 p.m. Okay. Please note that any revisions to the RFA will be made only by addendum issued by myself. So make sure that you have all of your, any questions you have into Veronica or myself prior to that date of, and you said it was January the 6th, 2023, Veronica, right?
Yes, January the 6th, Friday, January the 6th will be the last day of inquiries.
Okay, and I believe there will be some edits made to this as well when it's sent out. So we'll make sure that date is in there correctly. Okay, guys. You can go to the next slide. All right, application format and content. It's really important to make sure that you are aware and cognizant of the format and content requirements. You want to make sure that your application narrative is typed on 8x5x11. You also want to make sure that the font size that you're using is, 11 or 12 using conventional fonts, such as Times New Roman, Arial, or Courier. And also all pages of your narrative should be numbered. Applications must be organized in the order in which the requirements are presented in the application content and required forms. And lastly, applications submitted should not exceed 20 pages. You can go to the next slide. All right, application content. You want to make sure that you submit the following items as a complete application. The first piece of it is going to be your cover sheet. The application cover sheet must include the following information. You've got to have a project title, your legal name of your applicant organization, which is your faith-based organization and or institution. You want to also make sure that the signature of your authorized organization rep is listed on there as well. The address, city, state, zip, +4. Your application point of contact, a good point of contact number, email is really important as well. You want to also make sure that the health district locality is listed on there as well. Your total amount requested, and remember the ceiling is 40,000. So please be cognizant of that. As Veronica said, please do not submit for amounts over that. The unique entity identifier, which is the UEI number, which is replacing DUNS numbers. Your EVA registration vendor ID number, that is required as well. And your project start date and end date. You can go to the next slide. All right, number 2, your application narrative. Each section of the narrative should be clearly labeled, and we've added in a description of how, or example of how it should be labeled. And you definitely want to have a minimum of 350 word count for each area listed below. You've got sections A, B, C, D, and E. And then in regards to the activities, outcomes, work plan, we've actually included the form that you're to use. The template is actually provided for you, and it is a required document for this application. So it's very important that you use the template that has been provided. Okay, you can go ahead to the next slide. All right, next slide. Sorry. Okay, budget. I'm sorry, one more time. Go, yes. Sorry about that, guys. All right, budget and budget narrative. The budget narrative must justify all of your proposed expenditures by explaining the cost, how the costs were determined, and also calculations to support the expenses. And you just please note that any cost must be linked to the program goals and objectives. And if you don't do that, basically can result in individual line item requests not being approved, okay? So it's important for you to just keep that in mind. We've also provided a template for you, so be sure to use the template that is provided. And also please note that the signature is required, and I'm believing that a wet signature is required for this. Is that correct, Veronica? You guys need a wet signature, correct?
Yes, we do.
Okay, yes, so please note, please make sure that you include a wet signature on these. You can go to the next slide. All right, and then here we've got just a list of the all of the different attachments there. And this is just kind of like a handy list for you, just to show you all of the different attachments involved. You also want to make sure that you fill out that W-9 form, and that one does require a wet signature as well. And make sure that you fill out all of the other attachments as well, and submit those with your application as well. You can go to the next slide. All right, and again, you just want to make sure, as I stated, that you complete every single attachment. You want to make sure you're using all of the documents that we provided to you. I know that some of the applicants have maybe previously done business with the state of Virginia before, and you may have like some things already filled out on, but you want to make sure that you're using the forms that we provided, because we have the most updated forms in our documents. Please note that if you're not certain about something, please contact us prior to submission and inquiry end date, and that date will be edited as well. But you want to make sure you're contacting us in enough time, to not wait to the last minute in case you have any questions. Okay, you can go to the next slide. And let's see here. Just note that the review and selection process, we will do an initial review for adherence to the guidelines of the application. And we will, when we end that review, we make sure that the applications are complete, and that if you fail to provide the required information, you may be removed from consideration. Each complete application from eligible organizations will be read by a review panel, and we do rate the applications using the evaluation criteria that is indicated in the RFA. VDH will always endeavor to ensure subgrant awards are made within each region of the state to ensure a continuum of services is provided to the citizens of the Commonwealth. And this is just an example of the rating criteria, the evaluation rating criteria there. As you can see, it shows you the criteria, and then it shows the points available for each criteria. And I think I am going to hand it off to.
I think she's handing it off to me. This
Yes.
is Kim Bomey, and I'd like to echo my teammates' sentiments, and we're very pleased to have you all participating today. We thank you for your interest. I'm going to go over the program term conditions. The Department of Health reserves the right to reject any and all applications received in response to this RFA. We reserve the right to withdraw the RFA at any time at our sole discretion. We reserve the right to make an award under the RFA in whole or in part. We can disqualify any applicant whose conduct and or proposal fail to conform to the requirements of the RFA. We can seek clarification and revisions of applications, use application information obtained through site visits, management interviews, and the state's investigation of an applicant's qualifications, experience, ability, or financial standing, and any material or information submitted by the applicant in response to the agency's request for clarifying information in the course of evaluation and or selection under the RFA. Prior to application opening, we can amend the RFA specifications to correct errors or oversights, or to supply additional information as it becomes available. And if we do make amendments and changes like that, we would issue those on EVA so they're available to everyone. Prior to application opening, direct applicants submit proposal modifications addressing subsequent RFA amendments, change any of the scheduled dates, waive any requirements that are not material, award more than one contract resulting from this RFA, and conduct contract negotiations with the responsible applicants. Next slide, please. This is the payment terms. Disbursement of funds will follow a cost reimbursement procedure and will be for actual funds expended. In order to be reimbursed, funded entities must submit supporting documentation for all expenses incurred using the monthly invoice template that we've provided. Invoices must be submitted by the 20th of the month following the end of each month of service provision. Actual expenditures shall be invoiced pursuant to the approved line item budget categories of the subaward agreement. Funded entities shall be reimbursed only for costs that have been incurred with the contract period. Request for reimbursement for allowable costs incurred shall be submitted no more frequently than monthly. The funded entity should allow 30 days from the time request for payment are received by VDH until reimbursement is received. And this piece is fairly important. If errors are found in the expenditure statements, the 30 days will begin on the date that the errors are corrected. Next slide, please. This is very, very, very important. All invoices shall be submitted using that standard template that we're going to give you. And this information has to be included. We need the name and the address of the contracting agency. We need the federal identification number. We need the required certification that's signed by an authorized signing official according to the CFR referenced there. We need the point of contact for invoice related questions. That may or may not be the same person who signs off and submits the application. So there may be someone who's your financial person that will handle all the invoicing. So that name and contact information has to be there. You have to have an invoice number on each invoice submitted, and it may not be duplicated. If it's duplicated, it's going to cause a significant problem. Each invoice has to be dated, and it needs to reference the agreement number. So when we put in an agreement in place and it's been fully executed, the number that's assigned has to go on those invoices. You have to have the billing period for the current invoice and the current billing period cost listed by ledger category. So personnel, fringe benefits, supplies, that type of thing. Include cost sharing or in-kind donations if applicable. Year-to-date cost. So you want to keep that running budget against what your grant award was, and supporting documentation for reimbursable costs incurred. Next slide. And funded entities must submit the final request for reimbursement to VDH within 30 days. So by March 15, 2024, after the expiration of the contract period on February 14, 2024. And the funded entity shall be required to maintain accounting records to support all requests for disbursements. These records shall be available for review by the Commonwealth of Virginia, and VDH will monitor those expenditures accordingly. Next slide. And I think I hand it back to Veronica at this point.
Thank you so much, Kim. And we have come to the end of our information session. We're right at 2 o'clock. If you have any inquiries on this grant, please feel free to email myself or Kanique with those inquiries by no later than January the 6th, 2023. We have answered some questions in the chat box. But one in specific is that I believe there's Miss Katie. You can send me an email in regards to the non-allowable costs for our screening services such as COVID-19 testing. Is current screening services for COVID-19 testing billable things? And so if you can send me an email or something to have them additional, because it's different per establishment. Please, for that clarity, so I can make sure we answer your question. But all the questions that are in the chat box, what we will do is create an RFA for it, including past RFAs that we do have. So it's a running list of questions that our grantees have had for this grant. And want to say one thing in particular, This grant has been extended, meaning that initially the grant funding was specific to our faith-based communities, meaning our synagogues, our churches, our mosque. And many of those churches or congregations specifically either had programs that were established in there, but we've expanded it a bit. We know that some initiatives have expanded to and become their own 501c3, which are eligible. And then also, again, that our faith-based communities are partnering with CBOs to do that due to capacity. So this is in an addition to that, because we did get some questions on previous awards. But again, we have expanded the access to the funding. We do ask that those guidelines remain followed with the additions and providing supporting documents. If your questions were not answered, we will be doing a follow-up FAQ in regards to those questions and all the questions actually. And if you have any questions, please feel free to contact myself and Kanique. And what we will do, we are 2:03, so a little bit over time. But we started just a little bit late. So I thank you so much for joining. And we look forward to your applications and thank you for your interest. And so with that, happy holidays that are coming up. Happy holidays and happy new year. Again, we are here to support you. And again, this application closes on January the 23rd, 2023 at 3 p.m. Inquiries, Friday, January the 6th, 2023. Have a great evening. Blessings. Afternoon.